You know, as you're looking at the screen today, you'll see that we're showing the locations that the enrollment, the navigators will be located. But just remember as you watch that screen that we intend, Neighborhood Health Association and CareNet, intend to make sure that you have access throughout Lucas County and outlying counties as well. So counties like Ottawa and your other counties, Jan.
Sure, we cover up to the Michigan border, over to Indiana, and down, past Lima, Mercer County, and then over east as far as Huron County and Ashland County. So we really have a big service area, and we're partnering with local organizations, healthcare providers, as well as community organizations to situate navigators in each county and allow people to make appointments.
Yeah, and also you guys are covering Wood and Sandusky and Erie.
Wood, Sandusky, and Erie will be. We have sites already set up in Erie County at the Center for Family Services of Erie County. We'll also have. We just went with a partnership on Friday in Wood County with the Wood County Health Department, and then we'll be at in Fremont, in Sandusky County at the Fremont Community Health Services.
Okay, so please understand that coverage is expansive given the amount of resources that we have to work with in this part of Ohio, and there will be opportunities though provided by these fine people for most of you who are interested, almost all of you who are interested, to sign up for the Affordable Care Act. There certainly will be ways for you to contact people and talk about your options and your issues, and we'll show you hotline numbers and other contact information before we leave. Rollout. I hear you guys are having a big rollout, a party.
The question of the day.
Party.
The one everybody wants answered. We are December 4th. We'll be officially rolling out at the United Way. It'll start at 9 o'clock and we'll take it through the afternoon. And we'll be there doing some media stuff, and we'll be enrolling people by appointment. And hopefully we have a big turnout and everybody comes out and gets the first look at the Navigator team here.
Right. People can call 211, the United Way helpline, to make an appointment, and certainly if December 4th isn't convenient, 211 will get us the name and phone number, and between NHA and CareNet we'll make sure that we follow up with any individual interested in Navigator services and get them connected.
Yeah, remember 211, we talked about that a lot last week. That is the place you call for absolutely anything you need to know. United Way 211, just 211, and they will be able to connect you with folks who will see them and help them sign up.
Right, they can actually make an appointment to be at the United Way on December 4th for our big kickoff, and then throughout the month of December and on through open enrollment period and beyond.
Okay, all right. Anna, you wanted to talk about helping people get coverage?
Absolutely. One of the things that has happened ever since October 1st is that we've had people calling already ready to go as far as signing up, and sometimes when they call, they're actually a little bit frustrated. And so as a navigator, we're listening to what they have to say, and then understanding that we have to assess where they are in the process and what they need. So sometimes what we'll say is, where are you getting your care now? Because this coverage doesn't start until January 1st in most cases. So that usually has them understand that we care about them now, not just because they're coming to sign up. And then we ask them how they're going to pay for those services. And that gives us a tool to understand what is their current way to pay for coverage and where they're going to be in the process for healthcare.gov.
Yeah, and the really important thing about that, and I think the message we want to leave with people is, don't let anything you've heard dissuade you from contacting a navigator, finding out how this fits for you. You may very well be able to afford a plan, and if there are issues around that, all of the navigators are trained to answer those kinds of questions. So please, 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 this is about taking control of your life, changing your health care, changing your health status. So please call United Way 211. We'll give you some contact information at the end of the show to make sure that you get the answers that you need around this very, very important initiative. Brad, there is all of your navigators will be placed on December 4th?
Yes, we will have locations throughout the community, not just at the United Way, but we'll also be at our site locations starting December 4th, so people can come out. We'll be doing some sites will be on walk-in basis. We'll also do a couple sites that will be on an appointment basis. But starting December 4th, everybody can come out and visit us at one of the sites that we talked about before.
Is there intention to have evening hours for this
Yes,
coverage?
we will have. We'll have evening hours. We've struck a partnership with Toledo Public Library, and we'll be working into the evening with Toledo Public Library at those locations.
Okay, what about weekends? Any weekends?
We will do Saturdays, and as you talked about earlier, we'll also be doing outreach events that will hit Saturdays, and some will actually be on Sundays as well. So
Okay.
we'll cover the basis. Anybody who needs coverage. I mean, our goal when we started this, and we talked about it, it's very easy to get dissuaded by the politics of it and all that. The goal remains the same, and that's to get everybody coverage.
Right,
And we want to make it
absolutely.
as easy as we possibly can, and as convenient for everybody.
Yeah, absolutely. You know, the other thing too that's been amazing in this process as I've watched it is the community support.
Right.
Is it?
It's been amazing. I think that when we all went into this, we thought, oh, we'll work with our community partners. But when we not only are wanting to tell them what we're doing, but we're saying, and can we do it at your location? And can you provide us a room? And can you advertise to your constituents information sessions? The answer has been yes, yes, yes. We
Absolutely.
have gotten strong support. I think that everyone's goal is to get as many people covered as possible, and we're really working together to do that.
Yeah, and it's actually because of that community support that you all are so able to provide services around the counties that are being
Absolutely.
served. Toledo Public Library, I know you're using them an awful lot all over. Yay, Toledo Public Library and the Source and all Toledo Hospital and Mercy Hospital, and the list just goes on and on and on. United Way. Just goes on and on and on. Before we go, we only have a few minutes left in the show today. What's this HRSA.gov all about? Or is it healthcare.gov?
Healthcare.gov. That is the
Healthcare,
site.
yeah.
Healthcare.gov is a site that you want to go to find out what you're eligible for and actually to get enrolled. And then if for some reason that you have trouble getting to what you need to get to, there's chat features, there's 1-800 numbers, and there's a way to get the help that you need.
Okay. Is it an effective tool to use? Is it an easy tool to use?
You know, I think that once you get started, it is. If you just take it in pieces, because to start with, you're going to need an email address. So before you sit with a navigator, if you have time to go on your computer and set up your account, then there's an application process. Eventually, you get the subsidy back from the federal government. The plan designs are there for you to enroll in. Now, that can be a little difficult. I think in Lucas County with the 7 carriers represented, you have 72 plan options. So it's so nice to have a navigator sit there with you, not to tell you what to buy, to tell you what to filter on. How do you look for a provider in the correct network? How do you look for the drug list and whether or not your drug's on that? Is the hospital you want going to be in that particular plan design?
You know, you raised a really important point. The navigators are not intended to tell people what to do, are they?
They are not allowed to tell people what
Not
to
allowed to tell people. Just sort of, as you said earlier, just navigate them through the process.
Navigate them through the process. And Anna hit on a really important point, is that, you know, the process, it can be very difficult for some people, and some people can navigate their way through it on their own. It will help if people come with an idea of what's important to them. You know, what are your healthcare needs? What doctors do you like to use? What are your monthly prescriptions? Having all that information when you walk into the desk in front of a navigator will help you as we're able to filter through plans, and then you can make your decision on what's most important to you.
That brings up another point. Are there documents that people should bring with them to this, Anna?
They can bring documents if they want to, but if they could bring
But they
a
don't
list.
need
No,
documents
if they
to-
know Social Security numbers, if they know the current insurance, what the current income is, they're going to make an estimate of their 2014 income. If they could put that all on a document before they come in, then they don't have to bring in their formal documents. They can assemble the data that they need. But you know, we'll help them at multiple points. We don't anticipate that people will come in and start within creating an account and finish with a plan. There may be multiple trips, and that's good.
Yeah.
It gives you time to make that decision.
How long does the process take of enrollment? So if I'm wanting to make an appointment, how should I structure my day that day? How much time should I plan to spend with you guys?
Well, we are allowing an hour for each appointment, if that gives people an idea, because you know, some will be shorter depending on if they just set up an account and don't go any further, and others, you know, it actually probably could be more than an hour.
Yeah.
And it could be very short. We know that the website, we're hoping the functionality is improving after November 30th as promised. We know it's going to get there.
But yeah, and I need to ask this question before we go. I know it's the $24 million question. How is the functionality of the enrollment website right now?
We think it's getting better. I mean, we've seen incremental improvements in the website. What we're finding is that if they haven't been on to create an account already, it's a little easier to navigate them through it. If you have created an account and you've already had some hiccups in the stages, then it's a little more difficult to navigate through the website. So those that haven't created an account, the good news is we might be able to get you through pretty quickly. If you have created an account already, we may have some troubles with the IT side of it.
But you'll get them through it.
We will get them through it.
You'll
and
get
whether
them through it. So it sounds like you guys have been really busy these past couple months, really busy preparing for this. Anything in 30 seconds, Jan, anything you want to leave people with?
I just think to not be afraid to investigate what options they have, and I think that people will be pleasantly surprised with the choices
I
they
totally
have.
agree. And we also want you to remember that December 4th rollout, we're going to give you a bit more information before the end of the show today. We got to scoot away for just a second, but we'll be right back.